Thank you, Ranking Member Gillibrand. Thank you, Chairman and Ranking Member, for holding this hearing and working with me on these incredibly important issues. This conversation hits especially close to home for me. In April 2024, my father lost his ability to walk after an accident. It was at that time that we also realized that he had a rapidly devolving cognition, and soon after, my father was formally diagnosed with Alzheimer's. And I stepped into this role as being a caregiver. This is on top of me being a father to 2 little boys, on top of being a U.S. Senator. From that point onwards, I joined the Sandwich Generation, a community made up of millions already and we know that's only going to grow larger. The challenges of the Sandwich Generation touch all of our lives, but too often go overlooked or unnoticed. I bet we all know somebody managing the care of 2 or more generations of loved ones, holding down a job, keeping their family afloat while being squeezed on both ends, often feeling isolated and navigating these challenges alone. Estimates show that there are over 11 million Americans in this role. By 2030, baby boomers will be over the age of 65, and the demand on family caregivers already stretched thin will intensify. So why is the Committee on Aging talking about the Sandwich Generation? It's because the care that my aging father gets now is inherently tied to my ability to navigate, provide, and help pay for it. We cannot talk about the care for our seniors without considering the families and the caregivers that support them. I cannot be here at this hearing right now without having a caregiver there with my father right now to ensure his health. This committee has a unique ability to help caregivers be seen, heard, and understood. For too long, Sandwich Generation caregivers have fallen through the cracks of our policy frameworks. Part of the problem is that we are in the dark about how many truly exist because national data does not ask about multi-generational caregiving. You cannot build policy on a foundation you cannot see. That's why today I introduced bicameral legislation to add a dedicated question on multi-generational caregiving to national surveys so we can finally give the Sandwich Generation a permanent place in our national data. Understanding starts with listening. That's why I wanted this hearing today, to spotlight stories too often unheard. And now I want to introduce Kathy Lola, who is part of the Sandwich Generation in New Jersey. It is the stories like hers that we hear from now on that can best stand up for our caregivers. So I hope we can show the video quickly.
Chairman Scott, Ranking Member Gillibrand, and distinguished members of the Aging Committee, thank you for having me here today to speak. My name is Kathy Lola, and I am the mother of a 32-year-old with significant intellectual and developmental disabilities who I continue to care for at home. Several years ago, my dad was diagnosed with both Alzheimer's and Parkinson's disease, and I became an important part of his caregiving team. At that time, I also became a Sandwich Generation caregiver. Many Sandwich Generation caregivers don't even recognize our role as caregivers and are therefore unaware that support services may be available. From my perspective, as challenging as it was to care for multiple family members, I was even more overwhelmed by the complexity of the systems I had to navigate as I attempted to find services and support for myself and my parents. What would have made this process easier for us is having someone to guide us through these confusing and convoluted systems. Having a central hub of supports and services, as well as a navigator to assist with the processes, would have made our journey much easier. Sandwich Generation caregivers deserve more help and a better and simpler way of securing support for ourselves and those we are caring for.
Kathy is absolutely right. The system that caregivers navigate are complex and confusing, and I felt that myself. I'm so grateful to people like Kathy who are willing to share their story and be a voice to the challenges that millions are facing. What we hear today needs to be the foundation of continued action and progress towards a solution and relief our caregivers and our families deserve. Thank you, Chairman, and I yield back. Thank you, Ranking Member, and thank you all for your comments here today. Ms. Mayor, I'd like to start with you. Just first of all, thank you for sharing. And when you talked about just the isolation and the loneliness that you feel, I feel it too. And I know many others do as well. And I hope by hearing your story, hearing my story, hearing what we're talking about here today, I hope many that feel invisible, feel lonely, recognize that no, that there's many going through this together. And as you said, look, many of us are ready to step up for our loved ones and try to help. We're not asking for the moon, but the way I sort of say it is like, but it still doesn't have to be this hard. And I think one thing that stood out in your comments that I hear from so many others is many of us entered the sandwich generation. First of all, I didn't even fully understand that term, and someone came up to me and was like, oh, you're part of the sandwich generation. I'm like, I guess. But you're just so far deep in it. You don't even have time to step back sometimes and even assess that. But what you said, I think, stood out that I hear from so many others is that many of us enter this designation of sandwich generation through crisis. I had this circumstance where my father is literally going through surgery. We're finding all sorts of other problems simultaneously. And they're at, now all of a sudden I'm being asked to make decisions about his health. I'm being asked to understand, his Medicare levels, and I'm trying to understand his financial security when I was not, somebody that had, attorney privileges or had any other access. So I think just initially I was just overwhelmed. And I guess I just wanted to ask you to kind of talk through this, like the complexity of navigating, Medicare, healthcare, the financial systems and other things to be able to assess. Can you talk a little bit about how that affected you?
Absolutely. So much of what you said resonates with me. Certainly with my mom, I kind of call it, I didn't know what I didn't know as far as supports and services that might be available through federal or community programs. I had no idea. And when moving through healthcare providers, the hospital systems, discharge planners, we were never told about anything that might be available for families like us. So I didn't know what was there. And what you spoke about, where you're kind of initiated at a critical moment and suddenly you are the healthcare surrogate and you're making decisions. I did not have to do that for my mom, and my dad and I have had many conversations and planning meetings ahead of time about that, but I know that's not the case for many families, and they're kind of launched into this having no idea maybe what their older loved one even wants. Maybe their older loved one doesn't even have advance directives, so maybe they haven't even made that decision for themselves, and then they're left kind of guessing.
Yeah. No, I think that planning and trying to have that opportunity is something I'm trying to help engage, but also who do we turn to, for that? And Mr. Resendez, I wanted to turn to you. There was a quote that stood out to me when I was reading about the start of Medicare, for instance. President Johnson and Truman did this press conference together, and there's a line here I wanted to read to you. It says, quote, "No longer will illness crush and destroy the savings that they have so carefully put away over a lifetime so that they might enjoy dignity in their later years. No longer will young families see their own incomes and their own hopes eaten away simply because they are carrying out their deep moral obligations to their parents and to their uncles and their aunts." I wanted to ask you, do you feel like this original promise is being borne out in full right now, or do we still have work to do?
We've come a long way, I'll say that, in terms of the role of Medicare's recognition of the importance of supporting the health of older adults across the country, in terms of the way that we are investing in the health of older adults. We see that borne out by the longevity boom that we're experiencing in this country. But yet we have a tremendous road still ahead. We are living longer, but we are living longer in poorer health. And because of that, the demands on family caregivers have only increased. And one area where Medicare has not kept up is in recognizing the role that family caregivers play in supporting Medicare beneficiaries. So in terms of providing direct support for family caregivers navigating what is complex care, right? Changing wound dressings, feeding tubes, PICC lines. These are things that have historically taken place in acute care settings, certainly in the time when the program was established. It's now more and more happening in the home, and yet family caregivers receive very little support and training. That's starting to change in the Medicare program, and I think that's the next frontier as policymakers start to think about modernizing Medicare to rise to the moment that we're in for family caregivers.
No, thank you so much. I agree wholeheartedly. We've made great progress. And I read that quote not to necessarily say, we have not made more progress, but to try to recommit ourselves at this point to trying to follow through to that original goal, that we can have that sense of stability and security at a time when we are living longer, that we are finding ourselves sometimes in poor health, but we're also seeing healthcare expenses significantly higher than where we saw before. Families spread out further and other challenges. And one last thing I wanted to just ask Mr. Resendez is that I recently just introduced, as I said, this legislation today called the Multi-Generational Caregiving Data Act, mostly because I'm just trying to, again, make sure that we're being seen, that we understand, and we can make real rational decisions based off of that data. I wanted to just ask you what you think, whether or not you think that the lack of this comprehensive data so far has hurt our ability to fully understand what is the effects of multi-generational caregiving in terms of the limits on our abilities to fully understand what these families need, and how this data might be able to help policymakers, help us identify some of the gaps that are out there. We hear the anecdotal stories that are so powerful, but what is it that the data can do to be able to help us drive towards solutions going forward?
Absolutely. Thank you, Senator Kim, for your leadership in advancing that piece of legislation. Data is absolutely critical to helping us understand the full scope of the challenges that family caregivers face, particularly sandwich caregivers. And so having better data gives us the ability to make better decisions, to understand how caregiving changes state to state, federal program to federal program. So data absolutely can help drive change and help drive accountability, right? We're not going to change what we don't measure. And so by having stronger data systems in place, we can hold ourselves accountable, we can hold policymakers accountable, we can hold states accountable for the progress they're making in responding to the data that starts to come in because of these new tools and measurement opportunities.
Yeah. Well, thank you so much, Chairman. Again, thank you for holding this hearing, working with me on these. We have some real ideas. You have ideas, the ranking member, myself, and others. I hope that this committee can really try to accelerate that. So the hearing is really wonderful, but what our caregivers, what the sandwich generation needs is real solutions, and I'm grateful that you're willing to be part of the effort to be able to deliver that. Thank you, Chairman. Yeah, thank you, Chairman. I just have a few more questions here, just based off of what I heard. Ms. Prevey, I wanted to start with you. You were laying out some, all the different tools that are available and whatnot, and when we had a chance to be able to talk briefly, you talked about how more and more tech tools are arising that we can, start to think through how that might be able to help provide some support. So I guess I just wanted to ask you just more broadly, what gaps in resources do you see most frequently when working with sandwich generation caregivers? And what are your thoughts on how tech might be able to intersect and, things that we can think about how to be able to speed up and amplify and scale? I'd be interested in your thoughts on that.
Thank you so much for the question. Tech has been a game changer in the state of New York. And the reality is we do not have enough funding or services and supports to provide the level of care that sandwich generation caregivers need, but we do have technology that can assist us in that practice. And so really when we looked, when New York State Office for the Aging did the Working Caregiver Survey, they then developed tools for employers They also developed tools for employees to be able to access additional employee assistance benefits, things that already exist through employers that they weren't tapping into. I think specifically to some of our tech projects, I talked about Tralta through the New York Caregiving Portal. If you're a caregiver looking for services, you don't have time to Google what service you're looking for or what condition you are. Tralta gives you a standardized plan. So if I'm caring with someone with a spinal cord injury, I'm going to get information on mobility and transfers. Where if I'm caring with someone with a cognitive impairment, I might get information about sundowning. You can get that information in bite-sized increments, either podcasts, you can read materials, watch videos. They have a completely anonymous online support group, which has exploded with users because you don't have to turn your camera on and you don't have to say your name. And so caregivers that have this inherent thought process of, I can't talk about this being hard, are able to do that in a safe environment. The New York Any Care Counts campaign, that's a national movement that utilizes the Caregiver Intensity Index to score people and then instantly direct them not only to resources, but also what is helping your care journey and what's hurting your care journey. So in your situation, it might be beneficial to you that you have two sons that bring you joy and good family supports, but you might be really frustrated with the health insurance process and trying to get access to benefits for a loved one. It tells you that in real time, so you can then direct to resources that fix those. But then if you look at the others that I included in my testimony, we have deployed over 37,000 of the animatronic cats, dogs, and walkers, squawkers that reduce social isolation and loneliness. We've utilized LEQ, which is artificial intelligence robot that we put in people's homes that are engaging with older adults and caregivers repeatedly throughout the day. A caregiver can then send reminders to their loved one in real time through the tablet on the LEQ unit. And then there's a whole host of varieties of online supports for caregivers where they can learn additional tools like the Get Set Up platform that's free for any New Yorker, the Virtual Senior Center free for any New Yorker. We also have specialized television programs that we call the Netflix for dementia, where an individual can actually watch something pertinent to what was important in their lives, reduces caregiver burnout and stress because while you're making dinner, your loved one isn't watching a TV show that they can't follow. They might, I use the example today of a retired mechanic who watched a carburetor get rebuilt on the TV instead of just being stuck in front of Wheel of Fortune. And so all these things are not a replacement for the human connections. But they have changed the game in the state of New York as far as us reaching an additional 2 million older New Yorkers and their families through these low-cost, high-yield tech interventions.
Yeah, thanks for that. I'd love to be able to follow up and be able to learn some more there. Ms. Mayor, I wanted to just go back to you. You know, one thing that really stuck out, again, from your testimony is talking about how, you know, the entirety in which you've been a mother, you've also had this experience being a caregiver. And, you know, I hear from many about some of the tensions that come between that in terms of limited resources, but also just in terms of the challenges, for instance, of childcare and navigating with elder care. So I wanted to hear from you just, you know, how that affected you, you know, if there are any particular concerns that you had in terms of those trade-offs that you wanted to share with us.
Yes, absolutely. That was something that was a big challenge for me, especially when my boys were younger and they needed more hands-on care. It is very difficult to have intermittent care for children or for elder care. On both ends of the spectrum, there's often minimal hours, a certain number of visits each week, a certain number of hours required. And I understand that from the care provider standpoint, they need consistency and reliability, but it is very, very challenging to secure intermittent care. And when we did find somebody trustworthy, we had her come really for more hours each week than what we truly needed her for, because there's no infrastructure or system in place to meet the realities of the intermittent care that is needed. So we did what we could to keep her, and we know that we had the financial resources to be able to do that, and that not every family has that, but the being able to have care, elder care or child care, it's not just a financial barrier. It's becomes like an administrative and an infrastructural barrier.
Yeah, there are a lot of logistics there. Like, I know one of the things I didn't quite comprehend was just, with my father, as I said, he's not only has the Alzheimer's, but is unable to walk. And just realizing that, like, I do not have a car that can handle this, and let alone also, kid seats for my car, for my children, and just trying to just logistics. All of a sudden, I just realized that one day when I was trying to take him to another medical appointment, just those different challenges there. But the childcare is certainly something I'm hearing from a lot, just of the challenges of added costs as well on top of this all, especially when caregiving sometimes requires more of our time, as you were saying. Then that just increases again some of the needs that we then have for our kids. So just trying to understand that whole picture is important, because sometimes I feel like my identity as a father to two little boys is in direct tension to my identity as a son to my father, and it feels almost zero sum, in which that can happen. In some ways it can be, when I'm thinking about whether or not I can save for my kids' college, feeling like that's something I can't do in the way I wanted to, because of I don't know what's going to happen with my father's care and where we're going on that front. So thank you again for just sharing that with us all today. And Chairman, thanks again for your generosity and letting me be able to raise some of these different points.